Hello, welcome to the AEMT lecture series. This will be video number 3, video 3 for chapter 36, pediatric emergencies. Glad to have you guys. Get you something to drink, maybe coffee, maybe get you a Coca-Cola. Leave all that hard stuff alone so you can concentrate. You can't concentrate if you drinking the other stuff. All right, let me get back to where we were at. We're on bronchiolitis. We just finished asthma, I think. Yep. So bronchiolitis, we talked about it. But remember this: bronchiolitis is a respiratory virus, respiratory syncytial virus. Okay, so RSV. Less than 2 years of age is your primary target. Winter, spring months. Starts off with like a runny nose, mild fever, then you're going to get that cough, and then it progresses. So yeah, it's similar to asthma. It really is. You won't be able to tell the difference because they're going to have all those same signs and symptoms. You're looking at trachea tugging, nasal flaring. They're going to be tacky. Okay. And guys, I've never seen a kid. I mean, don't get me wrong. I know Eggleston does. There's some serious RSV out there. Usually in the field, I haven't ran into it that much. Always be prepared to assist ventilations, but this is just a pretty much treat and transport type of call. Then your pneumonia. So could be bacterial, viral. 1 to 5 years of age, low grade to high grade fever, dehydration secondary to fever. Okay, that's what you're looking for. Okay, and then hang on 1 second. Yeah, and then we have this yeah, okay, so this is basically aspiration. Aspiration, you get choked on something, you suck some fluid down into your lungs. Okay, and so that's what we're talking about here. And it's basically treat and transport. Let's talk about pediatric trauma emergencies. Number 1 cause of death in infants and children. All right, mechanisms of injuries. We should be kind of knowing that. Falls is the number 1 cause of trauma, but not necessarily the cause of death. Motor vehicle collisions is the leading cause of pediatric death. I wish my computer would behave itself just for like a minute. And why? Well, and then you have this, the leading cause of head injuries and new onset of seizures, epilepsy. Well, that's because of the head injuries, obviously, that they get from motor vehicle collisions. When the car seats, man, I'm telling you, placement's important. But I was putting my grandson's car seat in the car the other day, my daughter's car, and it was just, I mean, she has an older car, and it didn't have the, I don't know, those hooks that you needed in there. And so, but my daughter, she should have had that let's see here, should have had the another little buckle that came with it. She didn't have it, so had to get on Amazon and get that ordered. It's that important. I did. Well, I didn't. She did. She knew I was fixing to have a fit. An instructor Morse moment. But she's a good mom. And she ordered it. Took care of it. It was like $8. But you got to pay attention to that. You just can't throw a seatbelt around a car seat and say, oh, we're good. You're not. They're not designed like that anymore. Cars versus pedestrian, man. These are terrible. I hate these calls so bad. Golly. Oh, the kids playing in the street. And Bill gives a great class on this. I'll see if I can find those videos tomorrow. I don't know if you guys have seen them. They're real. Oh, God. Terrible videos of these kids getting hurt. I can't stand to watch it. But it helps to watch some of them because it kind of gives you an idea about mechanism of injury and how you can see a car with not that much damage, but after you see this video, you can tell how much damage it does to a child. That's terrible. Drowning's another one, man. I hate this call too. It's leading cause of death up to 4 years of age. My computer just will not stop. Alright, so near drowning means no death from the drowning, or they died 24 hours post drowning, okay? Because what happens is these kids will drown, they'll get pulled out of the pool, CPR even sometimes, and they'll come back around. And everybody's so thankful. They're awake and they're talking and it seemed fine. And just a few minutes ago they were dead, right? And now they're fine. But they're not fine because they have washed out a lot of their surfactant and they have a lot of fluid in their lungs, in their lower lungs, and they're compensating and nobody knows it. And 24 hours later they die. So that's the reason why that if you run up on that call and they say, yeah, we called, but oh God, he's fine now. It scared us so bad. That's needs to be a transport, guys. It needs to be, because this happens. This 24-hour thing happens. Greater survivability in cold water drownings. All right, so if it's a cold water drowning, we work them continuously, sometimes for hours. Yeah, and then we have kids getting shot today, more than ever. All right, so we got to add those into it. Burns are the leading cause of accidental death in 14 years of age or younger. Smoke inhalations, secondary to burns. It's similar to the drowning. What happens is they inhale superheated air and it causes swelling, inflammation, and all of that to start happening in the lower respiratory, where your alveoli are, and that inflammation takes over and it becomes very serious, and next thing you know, they can't have a gas exchange. And without a gas exchange, they'll die. And then physical abuse, child abuse. Always special considerations, right? Airway, pop-off valves in case, which is not really a problem nowadays with our BVMs. Do I see spine? Do I not? And don't worry about the uncuffed thing. That's for paramedics. Fluid resuscitation, bigger is better, right? Don't delay. Don't stop. Bigger being the largest IV catheter possible. We're not going to stay on the scene to start IVs, folks. We can do an IO however old. Don't worry about that's old. And then we're going to give a 20 cc or 20 milliliter per kilogram bolus. And then we'll rebolus if we have orders to do so. We probably wouldn't have time to do that. Don't worry about that. That's for paramedics. And then the big head equals big injuries, meaning the younger kids have bigger heads, right? Intracranial bleeding. So we have an increase in intracranial pressure. We'll see that in the blood pressure. They'll become very hypertensive. We'll see their pulse rate slow. Okay, their respiratory rate will be erratic. We check fontanelles to see. Remember earlier I said if that fontanelle's bulging. We're looking for pupils. Are they symmetrical or are they not symmetrical? And is the child posturing? So high flow oxygen, maybe, depending on their SATs, because we don't want to raise intracranial pressure. If they're 94% or better, leave them alone. Don't worry about that. That's old. That's for paramedics anyway. Death within the first hour, 50%. So you can definitely make a difference. If they do have a C-spine fracture, which is rare, okay, that's kind of rare. 70% is going to be C1, C2. And they can be fractured, but the spinal cord still be stable. Okay, it may need to be secured for sure, but so chest and abdomen injuries. Remember, their abdominal organs are exposed to injury. Higher suspect for injury. They're higher suspect because their rib bones are very soft. Okay, and so pulmonary contusions, cardiac tamponade. Their spleens are, like I said, all those organs are very, spleen, liver, they're not protected, and those are very, rich organs for blood loss. So we don't want to take that lightly. Green stick fractures, those incomplete bone fractures, like a green stick, and you're trying to break it and you can't break it. Burns are the second leading cause of death. All right, so airway management, don't worry about the ET tube, watch for hypothermia. And then we have SIDS, right? And risk factors, low birth weight, young moms, drug abusers, imagine that. Never would have thought that. Seems to be an increase in the fall and winter months. More males than females. And child abuse. Oh, Lord. All right, so child abuse. Let's say you're on the scene. I want to talk about this. Let's say you're on the scene and you suspect child abuse. You have a couple choices in how you want to play this. One, this is how I do it. If I'm going to transport to the hospital, then let's go. Because honestly, it's better. Because then I can get the physicians involved, and we're in a controlled environment, and parents can be confronted in a planned motion. And so it's much better if if you suspect child abuse and you're transporting, take care of that at the hospital. If for some reason parents are not letting you transport to the hospital, you have no other choice but to get PD involved. And those don't go as well. They just don't go as well. And there's reasons for that. One, the police department, they're not medically trained, so they don't pick up on the injuries as well or injury patterns. And so they don't get it quite as, get it as much. And then, then they have to get DFACs involved. And depending on how serious it is then, whether they'll have DFACs out that night or, you know, or not. So, but if you have if you have the choice, transport. And that is it for part 3, guys. So that is it for chapter 36, pediatric emergencies. And we'll see you guys on the next chapter.